Hey Ashlyn, how's it going today?
Hi, it's going great. How are you?
Good, doing good. So I know that you've been treating Mr. Smith, and who recently suffered from a stroke. And I know we're concerned about him going home and what that looks like for him. So I wanted to talk to you a little bit about the stroke program.
Yeah.
Obviously, we see a lot of stroke patients.
Of course.
We send out the usual, the PT, OT, speech therapy, skilled nursing for medication management and disease management, but I wanted to show you what that actually looks like for the patient in the home. So we offer them this book. So we leave this with every patient in the home. This is for the patients. It's at a 5th grade reading level, large print. We also have it in Spanish.
Oh, okay.
But it's just really easy to understand, and it helps them kind of take control of their own disease process. So it's really a workbook that they fill out. It's also for our clinicians to actually go through it with them, especially at the start of care. And it's just more education. It also has resources in here on like local support groups. And it gives them a place to really set their own goals and track those, the progress towards their goals.
I love that.
It gives them, we know that if you've had one stroke, then you're 25% more likely to have another one. So it also shows them ways to decrease that chance of having a second stroke. So
I did see on here the parameters for blood pressure. That's great, because a lot of times, they don't really think about it. They think, oh, it's a little bit elevated, but I'll be fine. But here it really tells them,
This tells them for sure if they're really at risk. We also have our stroke management zone tools. I know I've showed you those on the different
I love those.
Yes, so we have one that's specific to stroke. It shows where they're in the green, where they're in the yellow, and when it's a true emergency. So, we like to keep them at home. We don't want to send them back to the hospital.
Right, of course.
They just get weaker when they get in that hospital bed.
Yes.
So I just kind of wanted to show you this. This is just how we implement it. And then if that person has a stroke as their primary diagnosis, when we go into our tablet in the documentation, it automatically puts them in our stroke program. So it guides the therapist in what they should actually be doing, guides the nursing, is what they should be looking for, and things they need to focus on each visit.
That's incredible.
If someone has it as a secondary, like if it's an old stroke, maybe we see them, they had a hip replacement here, but then they're an old stroke, so they have those deficits. We can also click a button that they have that, and it'll put them in that program as well, even though that's not the primary diagnosis.
Yeah, this is awesome. And here it has what they should be eating.
Yes.
It's just a complete book.
It
wow,
is. It's got everything.
Great. Yeah.
It shows them how to read the food labels, things to avoid.
That's huge. Yeah.
Yeah, because they just go home and they eat the same things they always have. It talks about their dysphagia and the swallowing problems, how the different thickness of the drinks and different types of food. So again, they can put, my food level is this, my drink level is this, so they can really take ownership of that.
Right, I love this.
Yes, so they all get this. I can't leave it with you.
Oh,
it's just for the patient. But I just wanted to show you that, because I know that y'all worry about them after they go home. You've been treating them here, and then you want to make sure they're getting taken care of. So
thank you so much. Yes, thank you.
All right, thanks.